Hi everybody, it's Dr. Newman. I'm getting a lot of questions about Kylie Jenner's breast augmentation, specifically the issue that her breast augmentation was done, quote, half under the muscle. And what does that mean? Let me just explain the anatomy and what we do when we do breast augmentation. Virtually every breast augmentation I do is half under the muscle. It's actually probably closer to 2/3 under the muscle. But the important thing is that the muscle that we're putting the implant under is called the pectoralis or pectoralis major muscle. That's the chest muscle that you might see in a male bodybuilder that's so well defined. That muscle is not part of the breast. That muscle simply sits behind the breast. When you look at the anatomy of that muscle and you look at the anatomy of your breast, you would think that your breast comes down to where the fold is under the breast. That's the lower extent of where your breast is. Well, the muscle doesn't come down that far. The muscle kind of cuts across on an angle across your chest, actually inserts into your arm, and that muscle comes down on a diagonal. And when the implant is placed under that muscle, the implant is partly under that muscle, and part of the implant, the lower outer part of the implant, is actually slightly beyond the edge of the muscle. The muscle doesn't come down that low. So the normal under the muscle placement for an implant is a half to 2/3 of that implant ends up being underneath the muscle. It's important that when the doctor places the implant under the muscle, he places the implant high enough under the muscle, but not too high, and low enough beyond the muscle, but not too low. Depending upon the size of the implant, her implants, for somebody her height and weight, from my perspective, is typically a little bit on the larger side compared to what I typically use. But that muscle then pushes down on the implant slightly against the fold underneath. So if there's a lot of implant that's sticking out beyond the edge of the muscle, and it always does, it pushes against the fold. So I'll routinely put some sutures in to reinforce that fold so that as time goes on, that fold continues to be able to support the lower outer part of the implant. So I hope this clarifies a little bit what they're talking about with her implants being half under the muscle. It's a pretty common thing and a pretty normal thing in my practice. Pretty much all the implants are placed that way, but this hopefully clarifies what that means.